Hi, everyone. Dr. Michael Gartner here. If you're watching this, you've probably noticed something in the mirror that made your stomach drop. Maybe it's your hairline that looks thinner. Maybe your ponytail isn't full. Or you ran your hand through your hair and saw more strands than usual. You're not imagining it. You're definitely not alone. About half of all men and around 40% of women will experience noticeable hair loss at some point in their life. But here's the good news. In many cases, you can slow it down or sometimes even regrow what's been lost. And when you can't, there are real proven options that work. Today, I'm going to walk you through what's actually happening, what you can do about it, how to know when it's time to take that next step. Let's start from the beginning, the basic biology. So, why is this happening? Well, the most common cause is called androgenic alopecia, or pattern baldness. In men, it usually starts at the temple or the crown. In women, it shows up thinning through the middle of the scalp. Here's something interesting. A man can lose all the hair on the top, but still keep thick hair on the sides and the back. Why? Because those follicles are built differently. The ones on the top are sensitive to a hormone called DHT, or dihydrotestosterone, while the ones on the sides and the back are resistant to it. Think of DHT like rust on a pipe. It doesn't destroy the pipe overnight. It slows it down, clogs it, restricts the flow, and eventually shuts it down. That's what's happening inside the vulnerable follicles on your scalp right now. How can you actually stop this? Well, yes, you can, but two things that matter the most. First, the sooner you start, the better the results. These things happen for mild or moderate thinning, natural results first. So, what can you do when these follicles are thinning and can often be rescued? But once they're dormant for many years or gone, it's impossible to bring them back. Step number one, fix what's driving it. DHT doesn't appear out of nowhere. Your body makes it from testosterone using an enzyme called 5-alpha reductase. And one of the biggest triggers cranking that up is called insulin resistance. Yes, what you eat matters. When your blood sugar and insulin stay high from sugar, processed carbs, or a sedentary lifestyle, your body converts that testosterone into DHT. That's why hair loss often shows up along weight gain, fatigue, and brain fog. Here's how to calm it down. Cut back on the sugars and refined carbs. Eat more protein, healthy fats, and vegetables. Move daily. Even a 20-minute walk can help. You won't regrow hair overnight, but it lays the foundation. Without it, every other treatment is an uphill battle. Step two, wake up those follicles. Hair follicles need three things: oxygen, blood flow, and energy. And when they're starved in any of these, they shrink and go dormant, and then they're gone. Treatment option number one, topical treatments. Two FDA-approved options are minoxidil, which improves blood flow and works about 60% of the time if people use it consistently. Then there's finasteride. It blocks DHT more potently, but can cause side effects and needs a prescription. For natural alternatives, you could try rosemary oil, pumpkin seed, or caffeine serums. They're gentler, and while they're not as strong as medication, they can help with mild thinning if you catch it early enough. Option number two is microneedling, creating tiny micro injuries in the scalp, which increase blood flow and trigger stem cell activity. Research shows microneedling plus minoxidil works better than minoxidil alone. Option number three is red light therapy. Red near infrared light between 630 and 850 nanometers recharge and can potentially recharge the mitochondria in the follicles. You can use a cap or handheld device for about 10 minutes a few times per week. Option number four are PRP treatments. One study showed 93% of male patients reported that their hair completely stopped within 2 to 3 months of starting PRP therapy. Hair counts improved nearly 30% at 6 months. Another study showed a higher satisfaction rate than minoxidil by 50%. So a series of 5 to 6 treatments, PRP, separated 1 month apart, and most patients maintain those benefits for up to 12 months after their last session. Be patient. Hair grows slower, about a centimeter a month, even when everything's working. It takes 3 to 6 months to notice change. Stay consistent for at least 6 months before judging results. And remember, some follicles that have been dormant or gone for years won't come back. That's biology. That's not failure. So when you've tried these approaches for 6 to 12 months and see little progress, or if you've already lost a significant hair and you have baldness, these natural remedies won't help you. Only a hair transplant would. And that may be the next step. Let's be clear, getting a hair transplant isn't giving up. It's simply replacing those follicles that are gone for good with healthy, DHT resistant ones from the back inside your head. Modern FUE techniques, follicular unit extraction, are minimally invasive, leave almost no visible scarring, and results look so natural you won't even know. It looks like your own hair. It's just moved to where you need it. At our clinic, we combine transplants with natural methods that we've talked about. That way, you keep the hair you still have and permanently restore what's missing. So, where should I start? Well, if you notice your hair thinning, start with lifestyle changes, topical treatments, microneedling, and life therapy. Give it 6 months. If you've been losing hair for a while, add finasteride, and it's right for you. Continue red light therapy and start PRP treatments. If you lost a lot of hair and you have baldness, come schedule a consultation with me to discuss transplant options, the most reliable long-term fix. Final thoughts here? Hair loss can be emotional, but it's also treatable. Whether you're catching it early or years down the line, there's always a path forward. If you want to explore another natural remedy for hair loss, click on my next video about onions juice as a hair loss solution. Thanks for watching, and I'll see you there.